And welcome, I'm Dr. Deuk Majin. We're Deuk Spine Institute. We are performing spine surgery with a live stream so you can watch and ask questions and learn. Our patient, and I'll show you in a moment, has had a spinal fusion from L3-4, L4-5, L5S1. Can you see the x-ray?
Yes, we can.
And I will say this is masterful work. Masterful work. Why? Look at the curvature of her spine. It's a beautiful curve. The hardware is perfectly curved. The screws are big and strong. And by the way, I did the surgery. It was 17 years ago. She had a fusion. I did it, done at the hospital. She spent a few days there. Nowadays, we do these same fusions outpatient. But you can see the cages in between the bones. She has 3 cages for 3 discs that were fixed. 1, 2, 3. Those are called tantalum markers. They're little dots of metal marking the front and the back of each cage, top and bottom, so you can see where the cage is on an x-ray view. Now you can see the discs above the fusion at L2-3, L1-2 are degenerated badly. So she developed adjacent segment disease from her fusion. I have done over 1,000 of these types of fusions. Very rarely do people get adjacent segment disease, but it does happen. And it happened in her case. Okay, we're going to start by doing a little bit of numbing under the skin. Are you ready, Dr. B? Yes. So I'm going to numb it up. Lay still, you're doing fine. Everything's okay. Just to make it a little more comfortable, right? We'll give the numbing medicine a minute to work. Now, our goal here is to get in above her fusion at L1-2, L2-3 and clean out the 2 discs, tears, and bulges that are there so I can get rid of her back pain she's having above her fusion and get rid of the leg symptoms she's having on the right side from the pinched nerves. Any questions, feel free to ask us. We'll do our best to answer them for you. The alternative for her would have been to have another fusion. You can see with this marking pin, this scar from her first surgery that I did 17 years ago. That's the scar. It was a massive incision, massive surgery, and today's incision will be tiny, like around that big. Okay? So you can see the difference. It's always better to not do a fusion if you can avoid it. You comfortable? Our patient's awake for the very beginning, and I'm going to get started. Let's see where we are. It's a little higher than I want to be. I want to be lower than that. So let's do some more num-num. And we'll go a little lower. If you have questions, feel free to ask them. In the meantime, let's talk about the 30 different causes of back pain that people come in with. There are 30 causes, and some of those causes are more common than others. Let's take a look. I'm Dr. R. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. You can see from our animation that there are 30 different causes of chronic back pain, including the 5 discs, the 10 facets, the sacroiliac joint, the piriformis muscles, there being 2 of each of those. All right, this patient has pain coming from her discs. We are in the process of getting into those discs to fix them. She has a massive amount of arthritis right here. I'm trying to get past it. She also has a listhesis. Oh, the fish has worked again. My little fish. For those of you who don't know, Sean, the fish is, I watched a video the other day, these 2 fish crossing the road. So you could say, why did the fish cross the road? Well, they went to the pond on the other side. And would you ever imagine fish crossing a road? But to get there, they had to wiggle on the ground. They had to flop around, just like I flop around with my needle sometimes, for those of you who have watched me. All right, well, we are right at the back of this disc, and I'm flopping like a little fish, and it's gotten me this far, but will I make it into the pond? We will make it into this pond eventually, but not now, maybe? Maybe I will. All right, what questions do you have for me, Henry? Oh, it's still flopping.
We have a question coming from Raj on YouTube.
Hello, Raj. Welcome.
Asking, Doctor, are disc replacement surgeries the worst type of surgery you can do as they pop out and increase neck pain, high revision rates? I remember watching your spine scams exposed videos.
Yes. Artificial discs are not the worst surgery. There are far worse surgeries than that. But they are one of the more common surgeries recommended to patients. Therefore, they need to be addressed, right? Well, let's see. I'm right at the back of that vertebral body, and I'm in the disc space slightly, but I'm not as far in as I want to be. I'll play with it a little bit more. Nothing to do with Dr. Berndes or me. It's just her anatomy is extremely difficult. I would say the worst is laminectomy. That is the worst surgery you can possibly have done. And then spinal cord stimulator. Oh, I think we're in. Are we? Yeah? Well, we'll find out in a moment. Those procedures, laminectomy, discectomy, stimulator, they create so much problems for patients long term. They end up patients needing to have more and more surgery. If you have a disc pain from a disc, the best is what you're watching, the laser surgery. The next best is going to be a fusion like she had done before. And the third best is the disc surgery, the artificial disc. Okay, we're going to test her disc. Are you comfy?
You doing okay? She said yeah.
All right. So I know one of these needles is for sure in the disc. That's the L2-3. You can see it. Show us, Jordan. How bad is that? Pain.
Give us a number.
How bad is the pain?
10?
10?
Yeah.
Is that where you get pain?
Yes.
Yes, 10 out of 10 at L2-3. Sorry, L2-3. 10 out of 10. All right. So we just tested the L2-3 disc. You can see it.
Lay still for us.
Lay still. You're doing great. And this is fascinating. I want you, before you do anything, look at that next disc up, 1, 2. Do you see the dye in there?
Yes, we do.
That was sucked by the disc out of my needle. I didn't inject the needle. I didn't push the dye in. It literally sucked it in. And that's something called vacuum space phenomenon. Most spine surgeons know about it. When you have a severely degenerated disc, it creates a negative pressure. When you put a needle in connected to dye, it actually sucked the dye into the disc. That's incredible. I've never seen that before. Okay, are you okay? Shot? How bad is that on a scale of 1 to 10? How bad is that?
How are you doing?
What did she say?
What number? What'd you say?
How high did it go? 10. All right, so we got 10 out of 10 pain at both discs. You're going to go to sleep, and they're concordant. When you wake up, we'll be done. So what did we learn? We learned that both discs, the L1-2, L2-3, are causing her back pain that she typically gets. We call that concordant. That's why it's a C. And they're both 10 out of 10. We're going to get started with the bottom one first. Any questions? I'm happy to answer them. Shot?
At this moment, no current questions. So in the meantime, let's show the audience what are the how the disc cause back pain in the lower back.
Shot? I want to see where that guide wire is. Shot? Shot? There it is. You see it?
Yes, we do.
Yeah, I see it. Num num. Shot. How's your son doing, Dr. Berndes?
Still great.
Good. Still in Vegas?
Yep,
Enjoying his job? Shot? Good. Nothing better than hearing that.
very happy.
Don't move.
Cushman Wakefield.
Huh?
Cushman Wakefield.
Yeah, that's what you told me. They're a big national, huge company. Are we back?
Yes, we are back.
All right, let me know. So you've seen in the video how discs, when they're injured, they can cause back pain from inflammation in the tear. And Henry, let's show the audience how we fix these in a minimally invasive fashion that works really well. That thing is loud.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video, we are eliminating people's back pain in their disc with this laser surgery that is so minimally invasive and outpatient. They go home literally an hour after surgery. Let's just see where we are. Yeah, that's good. The whole surgery is done through a tiny tube, 7 millimeters wide. I apologize for the loud noise, but that's our laser machine, and it's the fan that cools it off. If you have questions, I'll be happy to take them, but we're going to get started. We already verified both discs are painful, and they're both causing her horrible pain, 10 out of 10. So, Henry, any questions?
At this moment, no current questions.
In that case, let's show the audience.
We just got a question, just as we said that.
All right.
That's coming from BJ on YouTube, asking,
Hi, EJ.
saying, "Hey Doc, can a herniated cervical disc that is pressing into the spinal cord cause any heart issues?"
That's a great question, EJ. Can a herniated cervical disc pressing on the spinal cord cause heart issues? Well, I'll be honest, it's not commonly talked about or described in the surgical community or medical community, but I believe the answer is yes. It depends on the heart issue, though. It can't cause every heart issue. Like certain heart issues, are due to other things like congestive heart failure, cardiac arrest could be due to hypoperfusion, not enough oxygen, not enough glucose. So there are things with the heart that cause heart problems that are not related to the spinal cord. They're more metabolic and vascular. And then there are things that could be related to the spinal cord because, after all, your vagus nerve and your sympathetic nerves innervate the heart, and they control the heart rate and the contractility of the heart, how strong it pumps blood, as well as the speed at which it pumps. And so, and also the blood vessels to the heart, the caliber of those blood vessels, those cardiac perfusion vessels, is regulated by the sympathetic and parasympathetic nervous system. And those are controlled by the nervous system and the spinal cord. So, long-winded answer, yes, but it's not well described, and I don't know the mechanism exactly, and nobody really does, to my knowledge. However, certainly it could be explained. Depends on the heart condition. Good question. Okay, The good thing about severely degenerated discs like hers is that they don't take very long to fix. So I don't expect to be here too long, but we have a job to do. We're going to get it done. Any other questions, Henry?
At this moment, no current questions.
There's the nidus of pain right there.
We just got another question coming from SourceFix on YouTube.
Hello, SourceFix.
Saying, hi doc, can I request for an elaboration on the inside out and outside in techniques and why you say the inside out is better?
Sure. So the inside out technique is where you basically place a needle in the disc like I did, and then you put a guide wire, and then you run a dilator down, and you basically Berndes, a little light. You basically start inside the disc and you work your way to the outside, from the inside to the out. That's why it's called inside out. That's what we're doing. That's what I do for every one of my surgeries. It's safer because the alternative procedure is to start in the neural foramen where the nerves are. And if you're starting in the neural foramen, there's a good chance you could damage the nerves as you're entering the foramen and you're trying to get to the disc. Plus, the inside out allows you to do a debridement, whereas the outside in does not. And the debridement is the key to eliminating back pain. So, safety and efficacy are both improved with the inside out technique over the outside in technique. Again, the outside in is where you start in the neural foramen outside the disc, looking at the disc, and then you move your probe from outside the disc into the disc, your scope. I will say that the difference is not dramatic. I mean, it's not night and day, but I think it is safer to do it my way, inside out, and the way of Dr. Young and many other endoscopic, transforaminal, uniportal surgeons like us. We prefer the inside out technique. If you look at the best surgeons, they do inside out. They don't do outside in. Anyway, that's my answer. I'm sticking with it. Any other questions?
At this moment, no current questions.
So this is pretty much calcified, scarred up herniation right here. Okay, not entirely calcified, like solid calcification, but it's becoming calcified, and that's a result of chronic inflammation. You can see some bone spurs in there. The nerve root's going to be up there, but I don't really clearly see it. It's just outside the tube. And there's a bone spur right there. I'm going to try to shave this bone spur down with the laser a little bit more than I have. A lot of people don't realize the laser can shave down a bone spur, but it can. The laser is a more precise tool than anything else in medicine used to remove things. I've used every tool in spine surgery there is. Everything from ultrasonic aspirator like a CUSA to a drill, whether it's endoscopic drill, microscopic drills, instruments, all those tools. The laser is by far, when you combine it endoscopically, is the most precise of all tools. All right. Well, I think we've done what we can here, and we're going to move on. Let's see. Maybe just a little bit. See if I can grab out any more. Disc. So is the next one. But yeah. I don't really see any more herniation, so that's a good. It's gone. Very good. We're going to come all the way out. You can see the outside of the disc. You can see what's left of the tear right there. The nerve is going to be right up here in this fat and soft tissue. But yeah, it looks good. Any other questions?
No current questions. So in the meantime, do we want to show the audience of the second?
That's too concentrated. Yes, let's show the audience how the facet joints cause pain. This patient doesn't have facet pain, but many people do. So it's good to be aware of facet pain. Welcome back. You can see from the animation that if you have trauma to your facet joint, you can actually get a tear in the capsule. And if you get a tear shot in the capsule, then that can destabilize the joint, cause inflammation and pain. And those pain signals travel up to the brain via sensory nerve shot called somatic afferents. And those nerves have a specific name. They're called the medial branch shot of the dorsal ramus. Medial branch of the dorsal ramus. And if you go in and just cut those nerves, then you kill the pain signals to the brain, and you can have a normal life, normal activities without having to have major surgery. And that's the best treatment there is the Deuk plasma rhizotomy. Going in and cutting those nerves.
And we just got a question from Raj once more on YouTube.
Sure, Raj.
Asking, hi doctor, do you get the herniation out fully in the affected disc? And how do you know if the pain would be completely gone after the DLDR surgery? Thank you again.
Raj, great question. So the question was, Dr. Deuk, do you get the whole herniation out in the disc that you're operating on? The answer is no, never. No doctor in the world can get the whole herniation out, no matter what surgery they do. It's impossible. But we get enough of the herniation out to eliminate symptoms. And how do I know? Because I've done this surgery 2,150 times, and the patients afterwards, their disc pain is gone every single time. 99.6% is our average. 99.6. That's 100%. So they still have pain from other areas, perhaps like the SI joint, the piriformis muscle, but not the shot, not their disc. Shot? All right. We're fine. Okay. Very good. Very challenging case for me because of the scar tissue infusion that was done from the prior surgery, but also the bones have slipped backwards with retrolisthesis and the discs are extremely collapsed. But it doesn't matter. All this stuff happening, and in the end, we can still get rid of the pain from the disc because we're treating the source, which is a tear in the back of the disc. Any other questions?
At this moment, no current questions. So in the meantime, we actually showed facetogenic lower back pain, but we didn't even show how it is that we cure it. Is there?
No. Okay. Sure.
Awesome. Let's show that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Laser.
Ready.
So, folks, welcome back. There's a piece of herniation right there. That was pushing on her nerve root.
We can see that, yes.
Oh, it's hard. I can't even pull it out the tube. I had to, couldn't pull it out the endoscope tube. I had to actually take it out the actual full tube.
It's worse than a dentist office.
Right? Oh, look at that herniation right there.
Just saw that, yes.
That's a biggie. Good job. Beautiful. We're almost 5 minutes, Dr. Berndes. 5 minutes. Almost done. So we never get 100% of the herniation. No doctor on earth can do that. Only God could get 100%. And I'm not God. So I don't even tell people. I would never tell somebody we get 100%. We get, on average, 60%. And all you need is 50% of the right amount, of the right part of the herniation, right? So if you look at the herniation, the part that causes the pain is the part that's stuck in the tear. And if you get that part out, then the back pain goes away. So you got to get the right 50% of the herniation out. And how do I know I got it? Because number one, I'm in the right place, because I'm transforaminal. I'm in the tear, and I start in the tear. That's the inside-out technique. And then number two, I can see with my scope. Like, I use the actual visual input from the scope to guide the laser to attack. Hey, she's moving a little bit. Dr. B, she's moving. She's moving. I think this is a painful area. It doesn't surprise me, to be honest. This is the worst part. And we know the outer part of the tear is the worst part. Just need a few more minutes. Any questions?
At this moment, no current questions.
Damn it. Grab her. I got about 2 minutes and I'm done. Is the last patient gone or still here?
Still here.
She
She's doing great. No nose bleeds.
she was sitting up, getting dressed. She was just sleepy. Oh, look at that.
Yeah, we see that.
I think that's it. That's. Oh yeah, all right, fine. No, I gotta just do one more laser and we're done. How much longer till you're back?
Oh, we're back.
Oh.
Yeah, no.
Okay, I thought we were on a video.
No.
So, Anyway, there's a big piece of herniation right there, guys. You see that?
Yes, we do.
Anyway, almost done. Here you go. Get the laser in, and we'll clean this up. I don't see any more herniation. Laser on, please. I mean, I don't see any more fragments, but this right here is herniation. And we're going to release it. So anyway, I was telling you last surgery or the surgery before about that movie, Fly Me to the Moon. Very good movie.
Oh, yes.
If you get a chance to watch it, it's with Channing
Tatum. And Scarlett
who
Johansson.
did a great job, yeah. And it's with, what's that woman? Scarlett Johansson.
Yes.
I mean, you know, right? Need I say more? And the plot is really, really good. And it's sort of a historical movie about the history of NASA. And it's fascinating to watch. My wife made me watch it with her. And I honestly am very happy we did, because it was a really good movie. So I strongly recommend, if you haven't seen Fly Me to the Moon, watch it. You'll love it. It's a really cool movie.
What's it on?
I don't know if it's on Netflix. I saw it on Apple.
Apple TV, yes.
Yeah, but it may be on Netflix. I don't know.
Yeah, they do share movies every so often.
I'm telling you, I would never watch it if it was up to me, but my wife got me to watch it, and I'm very happy that I did.
You gotta watch The Perfect Couple on Netflix.
Perfect Couple?
Kid,
Oh, right.
that was so good.
Really? The perfect 30 seconds.
One of the best shows on Netflix.
Really? I thought Nicole Kidman was like retired.
No,
Put out to pasture.
she's out here in spades in this show.
Ah, good.
Oh,
Her acting in this was tremendous.
Man.
I just looked this up, and it looks, yeah, it just came out like a couple days ago. That's pretty cool. Oh,
What's it called again?
it's called The Perfect Couple on Netflix.
You have a question?
Yes, we have a question from. I'm just going to go by the first name of Tallset on YouTube,
Okay.
asking, "Hi, how much is this operation?"
The cost of the surgery depends on what part of the spine we're fixing and how many discs we're fixing. If you want to know for yourself, it's best if you did a MRI review, free MRI review. There's no cost. And I will tell you what needs to be done, and we can find out the cost at that point. That's my best advice. All right, we are done. And I'm just going to grab one last little piece. That looks good. Yep, there it is. Okay.
We do have one final question.
I will take the final question.
Coming from Raj once more on YouTube, asking, "Doctor, does Florida have better beaches than California?"
Raj. Aha. Great question. Well, obviously, I would give you my opinion, but I could poll the OR, but the problem is they don't know California beaches.
I do.
All right.
Been there.
So then, for those of you who know California beaches, let's do a poll, and then I'll give you my answer after the poll. Who says California?
I do.
Okay. So you got one for California, and then Berndez, you're Florida? All right, so we got one California, one Florida, and I would have to say it depends on what you want out of the beach.
Yeah.
I know that's a cop-out answer, but California beaches are beautiful to look at.
When the sunset sets, it's the best.
Dirty, the watercolor is
Oh, please, please, please. Florida has prettier water, you know, and the sandier beach, like a nicer sand, softer sand. But the waves in Florida are very small, and the ocean is pretty calm unless you have a storm blowing in.
Yeah.
California has those mountains overlooking the ocean. Florida does not have mountains overlooking the
I was
ocean.
going to say it's much more scenic, just has more of an atmosphere there.
It's not Newport Beach. It's not.
It just depends on what you want. If you want to see a great white shark while you're swimming, then you go to California. If you want to see a bull shark while you're swimming, you go to the beach in Florida. I mean, really, it depends on how you define good, right, Raj? So I like them both. I can't really say one or the other. I'd say 50-50 for me. Yeah, Dr. Berndes is sold on Florida beaches. Sold. And the other one is one you get a sunrise, the other one you get a sunset, right?
Exactly, yes.
So that's important too.
The sunset in California are like incredible at the beach.
Yeah.
Incredible.
The water's cold in California. It's much warmer here.
Yeah, very true.
So, well, you asked a good question. You generated a controversial group of answers.
Seriously.
Thanks for joining us. We'll be
Yes.
back on Thursday for the big surgery.